So let's go back to the
So the next
program.
of the classifications, it would be your incomplete cauda equina, which is where you then start to, or the patient starts to observe some alteration in urinary sensation.
So what does it mean by incomplete? What is incomplete? Not complete occlusion of the canal, or
the cauda equina hasn't reached the point where the cauda equina syndrome hasn't reached the point where the nerves are no longer functioning.
Right.
So you're starting to get dysfunction in the nerves, but they haven't become completely dysfunctional. So the patient might say, I go for a wee and I know that I'm weeing because I can hear the noise, but I can't feel any sensation. I can hear the splashing of the water, but I can't feel anything. Or I'm becoming aware that I have a need to go to the toilet, but I can't actually initiate it.
executive bladder control.
That still means they can stop and start.
Seems like you have to wear a suit or something.
Well, you may want to when you get, particularly somebody as well dressed as you. But they still have control over when they stop and start urinating, and they're not incontinent, essentially what they have, the executive bladder control means. But there can also be perineal sensory changes. So again, changes in what we vaguely describe as the saddle area between the legs, the buttocks, the testicles, the genitalia. And then,
but you did say earlier on that these things could come on in a different sequence to this.
Absolutely.
Presumably you might get the perineal sensory changes before you lose your urinary sensation.
So don't be too hard and fast on what you consider to be the appropriate emergence of signs and symptoms. And we often see that the two most strongly associated or the most sensitive and specific symptoms are urinary issues and saddle anesthesia. The bowel changes, the sexual dysfunction are not particularly sensitive or specific. And that's probably because the bowel is a much larger structure, and because for most people one bowel movement a day or one every other day would be considered normal. So it might be a few, 3 or 4 days before they notice something's up with their bowels. Whereas most people will empty their bladder several times a day, so you would know fairly quickly that something wasn't quite right. So that's incomplete cauda equina. Then we go on to cauda equina with retention. And it's very much the same as incomplete cauda equina, but you then have painless retention of the bladder. So, I feel really full, I feel like I need to go, but nothing happens. Or for some people, what they first noticed is an overflow, so a gentle trickle of urine that they have no control over because the bladder is essentially overflowing, and urine is forcing its way through the sphincter. Right.
So it's control of the sphincter that's been lost because of the...
that executive control has been lost because the cauda equina have now started to become damaged by the compression.
Again, remind me, did you say people are likely to go through this progression? I mean, obviously they could go to full-blown cauda equina syndrome straight away, I imagine, but having started, would they likely to be going through each of these stages rather than jump from stage 1 to...
They're likely to go through stages, but what we can't be clear about is how quickly they go through those stages. That can happen within 24 hours, it can happen within 2 to 3 weeks.
Yes.
So what you're looking for is a deteriorating pattern. And then finally, complete cauda equina, which is, unfortunately at this stage, the horse has bolted, if you'll excuse the pun. I mean, that, the bladder is insensate. The patient has no awareness of the fullness of their bladder or needing to empty it. They have overflowing continence, loss of perineal, anal and sexual sensation, and at this stage, unfortunately, loss of tone. And this is, at this point, things are beyond repair, beyond help, and this is the point we don't want to be making the diagnosis. You hopefully are seeing patients before they get to this stage and are making a referral onwards.